So thank you for the opportunity to speak with you briefly about our recent article in the Mayo Clinic Proceedings, which was the latest in an installment of a series of articles on preoperative medication management that is brought to you by the Society for Perioperative Assessment and Quality Improvement. Hi, I'm Kurt Pfeiffer. I'm a general internist and the chief of perioperative medicine at the Medical College of Wisconsin. I'm also the president of the Society for Perioperative Assessment and Quality Improvement. And I'm speaking to you today about our recent publication, which is Preoperative Management of Endocrine, Hormonal, and Urologic Medications, Society for Perioperative Assessment and Quality Improvement, SPOCI Consensus Statement. This is an article like the others in this series that tries to provide both evidence-based and practical guidance on how to manage the medications for patients who are undergoing any type of invasive procedure. The overall work that our team has done in all of these medication consensus recommendations is to take a comprehensive look at all of the literature as it relates to preoperative medication management, and then distill that down into consensus recommendations, including in that some practical guidance and advice. The way we did these consensus recommendations was through a modified Delphi approach, in which we generated consensus from a multidisciplinary panel of experts throughout the world of perioperative medicine, including general internists, hospitalists, anesthesiologists, and appropriate specialists. In our paper on endocrine, hormonal, and urologic medications, we gave recommendations as to what to do with medications prior to the day of surgery as well as on the day of surgery, and then also included several other considerations that must be taken into account whenever you're trying to determine the best management for your particular patient. For instance, we provide comprehensive guidance on how to manage insulins of all types through the perioperative setting. We also include several special considerations that must be taken into account, for instance, for phosphodiesterase inhibitors, how they should be managed in a patient who is on these for urologic reasons as opposed to pulmonary hypertension, and to also point out specific side effects that would have perioperative significance. For instance, floppy iris syndrome in a patient who is on a phosphodiesterase inhibitor for benign prostatic hypertrophy. This is something that I think is really important work. For a long time, medication management has been something that is a struggle for people to keep up with the latest evidence. And also, since there are often differences between institutions in terms of how they manage medications. And so I think these consensus recommendations are going to provide a critical piece of information by consolidating the available information and providing consensus recommendations that bridge the whole spectrum of perioperative medicine and can give that kind of guidance that your practitioner needs at the point of care. So we look forward to getting feedback on these recommendation papers. There will be more to come. There are several more that are currently under review or in process that go along with a series of other recommendation statements that have been put forth from the Society of Perioperative Assessment and Quality Improvement, including for smoking cessation, cognitive screening, and frailty management. So I look forward to future collaborations between SPOCI as well as and the Mayo Clinic Proceedings, and thank you for your time.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.